My talk yesterday on the nursing symposium about information needs of myeloma patients along the illness trajectory was about a study we made where we looked at first how good is our myeloma counseling service at our hospital, and after that we asked the myeloma patients for their information needs, because I think it's important if you look at the whole long way with a lot of ups and downs in myeloma patients, to look where do they stand in this trajectory, and there are different information needs. So first we used EORTC QAQ Info 25 module to check how good is the satisfaction with our service, and we saw there is a lot of improvement, and we made different groups and different time points on the illness trajectory, and we saw that there are very much information needs in patient who has relapsed or are further on their illness trajectory. So we learned that we have to focus more on people with advanced disease with counseling. And then we looked what are the information needs of those patients, and after diagnosis there are more information needs about how does this affect my life, how does this affect my family. And as more you go further on the illness trajectory to the advanced disease, there are more and more the physical symptoms which are interesting for the patients, especially pain, fatigue, and excretions like diarrhea or obstipation.